much for having me today. I didn't prepare any speech, sorry, Virginia. I was anticipating to do some dancing instead. So, as Virginia said, my name is Josefine Antoniades. I'm an associate professor of health communications at La Trobe University. And my work really, I specialize in working with multicultural communities. And in this work, I very much focus on what we call co-design. And what's meant with that is really asking communities, working closely with communities and real people, rather than just sitting in our offices and doing our own little thing, which academics often do. So this is why I'm here today, rather than sitting at home in front of the fire in Melbourne, probably getting rained on. And the sun is shining here, so it's much better. I get to hang out with Virginia. My program of work has really focused on the South Asian community. I started my PhD looking at depression and help-seeking in Sri Lankan migrants many years ago. And ever since that, I've worked with dementia awareness in 10 different multicultural communities across Australia, developed more than, I think we've probably got something like 60 short films based on interviews with real people out across Australia, caregivers of people living with dementia. And I've also done a project in India, in Bangalore, which was quite special. And now I'm working on a couple of projects around dementia prevention, which came actually across because I was out talking about, what dementia was, and that's kind of, and how to get a diagnosis. And people are like, oh yeah, great, how do we not get it? And I'm like, okay, well, we got to actually maybe do something about that. Because there is lots of things you can do to prevent dementia, but also live. And the advice in that, the best advice we can give is actually really pragmatic. And it's about doing exactly what you guys are doing today. Being active, being social, eating the rainbow, eating really good, colourful, healthy food, and not the lollies, not the rainbow lollies, and not McDonald's, but it's okay once in a while. You're laughing over there. And so that's the program I'm actually here to trial this week, which I'm very excited about, a little bit nervous, starting the first trial on Monday in the Vietnamese community. So we always work in language, and I don't speak any of the languages. I don't get to speak my own language. Nobody's interested in the Danish community. I don't know why, I'm Danish. So if you hear a funny accent, try to guess where it is from. It's because I've lived in several countries, including Ireland. But everybody says, you surely must be from, South Africa. I'm like, I'm not from South Africa. Nevertheless, so that's a program of work I'm doing at the moment. It's always national because we want to hear from everyone. We don't want to just limit ourselves to Melbourne and Sydney. But also, Virginia is going to help me with a very special program, which is called Mind Care for Women, which clearly focuses on the ladies, because we're often left out of research, hilariously. It's like sneakers. They're actually designed for men, but just in pink. The program is we're going to co-design a dementia risk reduction program specifically targeting women, and I'm not just going to make it pink. There might be pink in there, though. I admit it. Well, no, it's going to be nice because I focus on aesthetics too. I'll be working with Virginia, so you'll probably get some invites to help me co-design that down the line if anyone is interested in some workshops. Another project I'm also working on is around trying to help people access aged care more simply. And I like to develop tools that it's not just about me publishing a paper and then putting it on a shelf somewhere and then leaving it. I want to give something back to the communities. My colleagues and I will always try and deliver a product. Maybe that's from my time in real life, working in industry, IT, that sort of thing. But when the projects are finished, we actually put all our materials, films, flyers on our website, so it's free, downloadable for everyone. So I'm also in the process of developing a navigation tool to try and make it easier for people to understand the Australian aged care system. But I want to co-design that with real people, so the people who have been using aged care in Australia and will be using aged care in the future, because I know how difficult it is. So I will be looking for people from South Asian background. I'm sorry.
Good.
Yeah, to help me co-design, share their experiences with me, because that is really what I need to know, where the problems lie, and also what they would like to see. So that's kind of me. And yeah,
That's a lot.
that's a lot. That's why I'm 25, by the way, not joking. So that's a little bit of what I do in my daily life. And then drinking a lot of coffees and teas and engaging with just delightful people like Bajinda and all the communities I work with across the country. So thank you.
Thank you, Josefine, and it's so good to have that. So Josefine and we met in Brisbane. We were in the conference and talking about my aged care. I was in the panel, I think, and you were in that in the audience, and the hassles that go through. So we hoping with Asha, we'll start Asha Care to give more care to our people and help them to navigate the my aged care system simplified. It's not easy, and I don't know, you remember I gave the example of listening to music, and listening to music you put it on. So hopefully together we'll be able to. Thank you, Josephine, and thank you so much getting us involved so that I can take the voice of my people to the people who are making policies. Simple as that, and we can do it together. Thank you.